What is radiation therapy to the breast? Well, radiation is basically therapeutic doses of X-ray beams that kill cancer cells. Generally speaking, radiation doesn't hurt on a daily basis. Radiation doesn't make you sick, doesn't make you lose your hair. Radiation feels very much like getting an X-ray. So basically you lay on your back, a bunch of beams come out of the ceiling that you don't see or feel. You sit there for a few minutes and then you leave. Not too big of a deal. The thing about radiation is it's markedly inconvenient because you cannot give a large dose of radiation to any body part all at once. It would cause damage to the tissue. So what happens is the radiation oncologist will basically prescribe a dose, which then gets divided into small daily doses over a period of time. That means you, as the patient, has to physically go to the radiation facility every day, Monday through Friday, for a treatment. Now, you can drive yourself to and from. The treatment itself is only 5 minutes, but the whole process is about 30 minutes depending on how far you live from the facility. Radiation for breast, generally very safe, doesn't have a lot of complications because they can bring the beams sort of from the side or from above or from diagonal, generally meaning the radiation beams are not transversing through your body in order to get to where they need to go. So basically your internal organs aren't really getting radiated. Now, of course, the skin and the breast tissue get radiated, so cumulatively over time, you can have sometimes some skin reactions, right? Generally redness or irritation, kind of like a sunburn. And in some rare instances, they can be quite severe burns where they peel just like you would, if you touch your hand to a hot stove. Really important to take care of your skin, which we'll talk about in another video. But generally speaking, radiation is well tolerated. Some ladies will experience significant fatigue that tends to be more pronounced if you had chemotherapy first. It affects everybody differently. We have to monitor your white blood cell count during radiation because in rare instances there will be an effect, your white blood cells or red blood cells.